The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We're gathered here for the next episode of TMD Demystified, and I am Tony Urbanic. Today's topic is hopefully going to be a very brief one because I don't have much to say about it, but it is a very important topic. And the title of today's topic is Night Guards and TMD. Night Guards and TMD. So there is a lot of confusion out there, even among dentists, but certainly among patients, about first of all, what a night guard is. Now, as my dental colleagues out there know, that there's a big difference between night guards and mouth guards. So, a mouth guard by definition is a device that protects the teeth and associated structures in athletics. The patients themselves confuse this all the time because if you have a sleep apnea device, they call that just about anything. They call it a splint, they call it a night guard, they call it a mouth guard. But that is a very specific device, which is not, we're not going to cover that today. And although that can be a very special topic as it is associated with TMD, because as I've mentioned on other episodes briefly, and it does deserve, I think, its own episode, a sleep device, by definition, puts traction on the mandible to bring it forward to increase the airway, posterior pharyngeal airway, which frequently can create TMD damage and TMD symptoms. But that is a different topic for a different day. Today, we're going to focus on night guards. So a night guard is not a mouth guard, and a night guard is not a device that treats sleep apnea or snoring. A night guard is usually an acrylic device, although now more often they are made in resin and can be 3D printed, which covers the surfaces of the teeth that protect the surfaces of the teeth. That is the description and a definition of a night guard. And they are very effective on protecting the teeth. If you have a bruxer, a patient who clenches and or grinds, either day or night or both, construction of a night guard will protect the surfaces of the teeth so they cannot damage the surfaces of the teeth. They will damage the night guard, but they can't damage the teeth. And it does an excellent job of doing that. And that is all the night guard does. And that is really the issue and the point that I want to drive home on, hopefully, my brief discussion. But the circumstances are, and the facts are, very underwhelming. And that in the United States of America, with right now, I believe approximately 180,000 dentists, and likely 160,000 of those are active practicing dentists. Literally half of the dental community makes a night guard and tells the patient that this will have some beneficial effect on their temporomandibular joint symptoms, which frankly is not true. Now, I've mentioned this in other areas and other times, briefly, but it really does take a little more emphasis and a little more description as to maybe why that doesn't happen. But if you have a device, an oral device that is promoted, and it is promoted in certain fields, parts of the dental establishment, that to make a night guard for the treatment of TMD. I think, in fact, I know that still in some dental schools, they are using night guards for TMD. Certainly, the trade journals in dentistry, the trade journals, promote the use of a night guard for TMD. Not all of them, but I've read many of the promotional articles in the trade journals, and they still mention TMD as a reason to make a night guard, which is absolutely not true. So 50% of the dentists in the United States of America, when faced with a patient that gives them complaints and symptoms of TMD, they will make a night guard and give it to the patient and tell him this is TMD treatment. And the other 49.9% of dentists don't want anything to do with TMD, so they don't make night guards. So right now, we're just speaking to the half of the dental community that does make a night guard and thinks this is beneficial to the treatment of TMD. And I know this is a fact because for years, I mean, too many years, approaching 50 years, talked to my dental colleagues on this issue of TMD and asked them how they treat it and what they do and what they think. And when I discuss this with any dentist, as currently as last week, and I say, 50% of the dentists make a night guard and give it to the patient as treatment, and everyone shakes their head. This is an assumed truth, an assumed number. And whether they do themselves or they know their colleagues do it, they know what's going on. So this needs to be addressed. This needs to be fixed when you have that many dentists using a device that is not effective. So what is a night guard other than it covers the surface of the teeth? Well, first of all, a night guard has no effect on the degree of bruxing. So let's just a few words about bruxism. A well-established, versed, extensive search of the literature will prove that we have no idea the mechanism about bruxing. Now, when I say mechanism, I mean neurological mechanism, neurological, physiological, myological, muscle mechanism for bruxing. Now, we know that the muscles are involved, we know the nerves are involved, but we don't understand. We know that the signals, the neurological signals, originate in the brain stem, where the nuclei of the cranial nerves arise in the brain stem of the central nervous system. We know that, and I've discussed that in previous episodes on how a device that separates the back teeth work. But the point is that the signals for bruxism have to originate from those nuclei in the brain stem. What we don't know is this. We don't know how anxiety and stress create the origination of signals in the brain stem. Now, there are theories, and maybe some of those theories actually are true, but we don't know for sure. But the only thing we know about bruxism, whether it be clenching and or grinding, night or day, that is the definition of bruxism, the only thing we know about it is related to stress and anxiety. We all know that. We all know that by personal experience, a self-evident truth that anxiety creates bruxism in some people. My estimate is roughly half the population. Most of those people are not aware they're bruxing. They brux to the degree that they do damage to the teeth and to the temporomandibular joint, but they're not aware of it. How do I know that? Because we interview and do consultations with thousands of people and literally ask that question, whether they are aware that they brux or clench their teeth. And half of them are aware they do it that have TMD, and half of them are not. But the point is that the only thing we know for sure about bruxism is related to stress and anxiety, but we do not fully understand how anxiety and stress creates the stimulation within the nuclei in the brainstem of the nuclei of the cranial nerves associated with causing the muscles of mastication to move and brux the teeth. Don't know. And so keep that in mind. That's a very important concept to keep in mind when we talk about night guards. All right, so a night guard covers the surfaces of the teeth. A night guard does not stop people from bruxing, although I have had hundreds of patients report that their dentist gave them a night guard, and whether the doctor said it in words or inferred it, or the patient just came up with the concept themselves, which all three of those could be true. But I've had hundreds and hundreds of patients, if not thousands, out of 6,000, a couple thousand possibly, who tell me that someone gave them a night guard for their bruxism, expecting it to stop the night guard to keep them from bruxing. Well, that is definitely not true. We do not even understand the mechanism of bruxing, let alone how to get someone to stop. And certainly a night guard does not get someone to stop bruxing. And so that is point one. And I've heard it so many times, is why I decided to actually call out this thing called a night guard and discuss it thoroughly so there's no misunderstanding. The whole thing about education is to develop understanding, to give basic information, truthful, basic scientific information, to create eventually a level of understanding, and in this case, understanding the relationship between a night guard, bruxing, and TMD. Okay, point one, a night guard doesn't have anything to do with limiting, discouraging anything about bruxing. If anything, a night guard can encourage bruxing, and that is a fact. Because many of those 6,000 consultations that I've done in the past several years have said that they were given a night guard, and the night guard actually made their TMD symptoms worse. In other words, their headaches were worse, their jaw pain was worse, their ear pain was worse. And that was reported by many patients. Not all of them. Some patients seem to tolerate a night guard well that also have TMD symptoms, but the night guard does not improve the TMD symptoms. So that's point two. A night guard does not improve TMD symptoms. If anything, it can make, in some cases, make TMD symptoms worse. So night guards are a night guard. It covers the surface of the teeth, and if that is your intention, and if that is your purpose, then I fully support and encourage you to make a night guard for patients. But keep in mind that a night guard can actually do additional damage to the temporomandibular joint, either by encouraging the patient to do more bruxing or to increase loads on the joint while they are bruxing. So a night guard actually can have two specific reasons or purposes to increase temporomandibular joint symptoms, one being increasing the level of bruxing, because if you have, and whether you use one, I have some patients who bring in maxillary and mandibular night guards simultaneously. And whether it's a hard or soft material makes no difference. Of course, the patients will chew through the night guard much faster and earlier if it's a softer material, and cannot chew through a harder material as fast, but I've seen it both. I've seen patients absolutely destroy a night guard in relatively short order. So night guards can be used to cover the surfaces of the teeth, protect the teeth, but in many cases, they will increase symptoms and have no effect on decreasing symptoms of temporomandibular joint disease. So for those who, for whatever reason, have been taught or think or read that night guards can improve TMD symptoms, let's talk about why they won't. And that is that loading the joint itself, one way or another, overloading a joint creates joint symptoms. Let's start there. So whether we're talking about the temporomandibular joint or a hip or an elbow or a knee, damage to that joint occurs by overloading the joint, either through overloading the foot-pounds of stress on the joint or the overloading by repetition or both. So you can overload a joint. Let's say, think about something that would be self-evident and you'd understand. Overloading a hip or a knee. I think knees are more common than hips, but I don't know. That's a guess. In my age group, I have a whole lot of friends that had knee surgery, more knee surgeries than hip surgery, so that's where it comes from. But the issue was all of my friends and colleagues who have had knee surgery, they've had knee surgery because one way or another they overloaded the knee, either through athletics or repetitions at the gym or become joggers, which was my issue. I was a jogger all my life and I have one bad knee. And that is because the knee became inflamed over repetitious and overloading of the knee joint. Well, this same concept applies to the temporomandibular joint. And the only reason the temporomandibular joint is damaged is overloading the joint. And overloading the joint can be done through the three causes of overloading the joint. Bruxism, acute trauma, like automobile accidents is the most common, and whiplash is the most common issue with automobile accidents in overloading the joint, creating damage to the joint. And then chronic overloading the joint, which can be arise through functional malocclusions. And we've talked about functional malocclusions many times, but those are the only three causes of damage to the joint, which is bruxism, acute trauma of various kinds, fall in Tennessee, kicked by a horse or fall off a horse is very common, and then functional malocclusions. They are the issues which cause chronic inflammation in the temporomandibular joint, and the chronic inflammation drives all the symptoms. We've talked about that many times. But a night guard stuck between the posterior teeth, covering the posterior teeth, will actually increase forces on the temporomandibular joint, whether it be upper jaw, upper teeth, upper occlusion night guard, lower occlusion night guard. When you stick something between the front teeth, it just gives the patient something else to chew on, and at times can increase forces on the joint itself. And when you increase force on a joint, it is more likely or probable that it will break down. So it's force and repetitions eventually will cause a joint to break down. And so that applies to the temporomandibular joint like it applies to the knee or the hip or the elbow. Tennis elbow, actually not so much force, but repetition, constant repetition, repetition, repetition is tennis elbow, creating inflammation in the lateral epicondyle, which translates into the mechanism, which the orthopedic surgeons call joint splinting, which creates a signal, autonomic signal, going to the brain stem that says I'm inflamed here at the lateral epicondyle. The brain stem sends out a signal to the muscles in the forearm, which move the elbow, tennis elbow, and to tighten up those muscles, which tennis elbow complaints are not complaints of pain here so much as pain here. When those muscles get tight and they pull on the periosteum and stimulate the nociceptors in the periosteum, patients will complain of pain in the forearm and the wrist. That is the exact same explanation of what TMD is. When this joint becomes inflamed due to, in this case, bruxism, acute trauma, or functional malocclusion. It sends a signal to the brain stem. The brain stem says, I'll help you out, tighten up. First, it tightens up the muscles of mastication, at which point where those muscles of mastication, the origin and insertion of those muscles attached to the bones, the mandible or the maxilla, even in here, patients will complain of various facial pains, which can be treated nicely by unloading the joint, by unloading the posterior teeth, because 90% of the loads on the temporomandibular joint come from posterior teeth. You were all taught that in dental school. I assume you're all taught that in dental school, but again, talking to hundreds and hundreds of dentists, they all agree, yes, I was taught that in dental school. 90% of the loads on the temporomandibular joint come from the posterior teeth. So circling back, if you have a device, night guard, that covers the posterior surfaces of the teeth and occludes with the other opposing surfaces of the posterior teeth, you will likely load or overload the temporomandibular joint. So a night guard has no effect on treating temporomandibular joint disease. But it does work really well on keeping the teeth themselves from being damaged. So, can you use here's the question. Can you use a night guard when a patient has temporomandibular joint symptoms? Well, if you know the patient is a bruxer, I don't think there's anything wrong with covering the surfaces of the teeth to protect the teeth. On the other hand, don't tell the patient it's going to treat their TMD symptoms. You can tell them it may make it worse, or it may not have any significant effect on it at all, which is the most likely. It is possible that you could, and I've seen it, patient is put in a night guard and it has no effect on the temporomandibular joint symptoms, but the patient will bring in the night guard and show me how they've chewed through that particular night guard. Or more likely, and this is common, had one this week, yesterday, where a patient brought in several night guards that were constructed by several different dentists because of their temporomandibular joint symptoms, and they had chewed through or chewed up each and every one of those night guards. So I think I promised to make this one a little brief, and just to summarize for your benefit, for your understanding, when I speak, there's no way to not come across to some extent from a critical standpoint. It is not my intention to criticize, just to criticize. It is my intention to criticize, to enlighten, and increase the level of knowledge and understanding about this conundrum, and continues to be a conundrum until the majority of dentists figure out that it is a solvable conundrum, and the appropriate method how to solve it non-surgically. So my intent is not to criticize, it is to enlighten and educate, and eventually get to understanding that TMD is not a complicated problem when you understand the mechanism of actually what's going on, which is the tennis elbow mechanism. Tennis elbow and TMD are the same disease. When you understand that from a starting point, then it all kind of comes and makes sense. And then in treating a patient, you can walk them through the steps using a device which consistently, according to a protocol, separates the posterior teeth according to a protocol, which allows the inflammation to die down. All of the symptoms are directly stimulated by chronic inflammation within the joint. And when you allow the chronic inflammation to diminish to a point, then all the symptoms disappear. And that a night guard does not allow that to happen. A night guard does not help. But you could use a night guard if the patient needs or wants to make sure, and there are very good reasons to cover the surface of the teeth. If you have extensive crown and bridge dental implant reconstruction, or you see someone just flattening out their occlusion, and I've seen so much of that, there's good reason for night guard, but don't tell the patient that that night guard is going to treat their TMD symptoms, or for sure that it's, or certainly don't tell them that it's going to decrease their level of bruxing, because there is no solution for bruxing. If patient is a bruxer, they're always going to be a bruxer. When I talk to patients in depth about their bruxing, invariably, we find out that their bruxing starts out very, very early in their life. I can give you so many anecdotal examples of that, just hundreds. Bruxing starts very early, and the patients are not aware of it. All right, so night guards don't help bruxing, and night guards don't help TMD. A night guard can have its place, but it's a very limited place in the treatment of a patient by just protecting the teeth themselves. But make sure your patients know that it is not going to help their TMD symptoms, and it is not going to decrease their level of bruxing if they are a bruxer. With that being said, I think I covered it all. And I appreciate your attendance. I appreciate your cooperation. If you would like to contact me personally, I can be reached at tony@tmjservices.net. If you'd like to learn more about our device, which is appropriately named because we had to name it something. It's named the Urbanic Device and Protocol. That can be viewed at www.urbanictmj.com. I'd encourage any listeners to become involved. If you would like to learn how to become a provider for the device and protocol, that can be done through the website. Again, www.urbanictmj.com. And regarding criticism, I welcome criticism or discussion. I have no problem. If you question me on anything that I try to teach or discuss, I will do my very level best to back it up with statistics and science, and I would hope you would do the same. With that being said, I look forward to the next time that I have your attention, which will be in a week. I always do these on a Tuesday morning. And with that being said, I look forward to the next time I can speak on a relevant topic to the temporomandibular joint conundrum on this podcast, TMD Demystified. I am Tony Urbanic.